you see that have this?
My name is Jorge Llibre. I'm from Cuba. I work at the National Institute of Neurology and Neurosurgery. I came to San Francisco in 2016 in order to start an Atlantic Fellowship at the Global Brain Health Institute. This is an open program where you get training in diagnosis, treatment, but also about ethics around dementia, also how to work with the community, how to implement policy around dementia.
We established the Global Brain Health Institute to try to address this very large worldwide problem of dementia. Dementia's largest risk factor is getting older, and a lot of the world's aging is occurring in low and middle income countries, disproportionately affecting populations with less resource.
Cuba has a rapid aging population. It's one of the oldest populations in Latin America, and by the year 2030 will be also one of the oldest populations in the hemisphere.
The burden of the disease is substantial. It's the most expensive disease in the world. It costs more for care than taking care of cancer, heart disease, and stroke combined. But it goes beyond that. If you think about the determinants of dementia, they're tightly linked to the same social determinants that drive physical illness: hypertension, access to medication, depression, that are disproportionately affected in populations that often don't have access to care. So the determinants of dementia are also tied to equity. There are a lot of reasons why Cuba is an optimal place to partner. Some of the models of healthcare are truly models that we can learn from.
The Cuban system of health is based on basic principles. One is focus on prevention. The other one is that universal access to care. And the other thing is that it's completely free. Cuba have structured 3 different levels of attention. You will have a community doctor. That community doctor is not only a primary care provider, it's a community doctor that is part of your neighborhood, that knows you, that knows your family. We have a second care level of attention, where health issues that cannot be resolved in the primary care setting will go to the general hospitals. And then there is the national institutes of the different specialties, where more complex patients will be referred.
If you look at the model of care in Cuba, it is largely an example of how public health approaches can provide good care. So you can automatically see how one might leverage that system of care to try to address dementia on a broad public health way.
In 2016, the National Plan for Dementia was approved by the Ministry of Health. The idea behind this plan is to build memory clinics in the community, where we will train doctors, neuropsychologists, but also social workers, lawyers, to deal with patients and to deal with families that are living with dementia.
Una vez que se le diagnostique, pues se derivan a grupos de cuidadores. En estos grupos no solo van a recibir esta información de profesional, sino que van a recibir también la experiencia de otros cuidadores que también están vivenciando por la misma situación.
If Jorge designs with our support something that really works well in Cuba, I can see that it could be replicated in places around the world. It aligns so incredibly strongly with what we're trying to do with the Atlantic Fellows Program. How we can learn from Cuba, how we can engage with lessons from Cuba, how they can learn from us.
We have the frontal lobes, parietal lobes. The Atlantic Fellowship is not only a training program, it's an exchange program where you receive training, but you also share your experience. So sharing that experience of equity that we have in Cuba, it's something that we are bringing to the experience of the Atlantic Fellowship.